Hi, I'm Dr. Jim Hoven of Ramos Law and your host for Health Matters. Have you experienced hip pain? First of all, we have to decide what kind of hip pain it is, and second, what to do about it. That's what we're going to deal with and go through right now. When people say they have hip pain, what I've found is, as I've seen patients like this for years, oftentimes they're not really understanding where their hip truly is. So when they say hip pain, sometimes they're talking about behind them what we call the sacroiliac joint or the SI joint, and that's kind of at the base of the spine off to a side. Some people call that their hip. Some people will call their hip actually where the leg bone comes into the pelvis, and that's the true hip. Now, one of the big common injuries to a hip is called hip bursitis, and that's what we want to talk about today. Hip bursitis is where a fluid-filled sac called the bursa gets inflamed. So when anytime, and you can keep this for future reference, anytime you see the words or the letters itis after any word, that means inflammation of that tissue. So bursitis is an inflammation of the bursa. So that's how you can remember what's going on in some of these medical conditions that you might hear or read about or get a diagnosis yourself. So anyway, when it comes to hip bursitis, what can happen is irritation from movement or from trauma can cause that sac, that bursal sac, to start swelling up. Now, oftentimes, if we can take away the stress and help just alleviate some of the tension that caused that, the body will resorb some of that fluid, but sometimes the damage can be so great or it's ongoing. Let's say you get in a car wreck or you fall off your bike or you get hurt at work, something like that happens. Now you've got that fluid-filled sac that's irritated. In the meantime, we still have to walk around and do our daily activities. We're trying to stay active. We're taking care of kids. Maybe we're still working out. So we don't give that a break. Maybe the way that we sit is putting stress on it. We're crossing our legs. All of these things continue to put stress on that bursal sac, which continues to add fluid so the bursa stays inflamed. Now, in easy cases, by just taking stress away, that can help and make the bursa go better, and so your bursitis gets better. But there are some cases where that doesn't happen, and in those situations, we need to go to pain management doctors, sometimes orthopedic doctors, and they can do the appropriate procedures to help that bursa. Sometimes it's draining them, it's taking a needle and pulling that extra fluid out, but what we have to watch there is, did we get rid of the reason that the fluid is going in the first place? That's where you need to understand with your healthcare providers exactly what's causing this. So bursitis is no joke. It can be really sore, very painful, and actually quite debilitating if it comes up. So if your hip is hurting, and this is again, not by your SI joint, but your actual hip, which is the leg bone attaching into the pelvis, great idea to get someone get someone to look at it and take care of you, get an accurate diagnosis, because there's a lot of hip complaints, a lot of diagnosis for the hip as well. So just make sure you get that checked out. Now, if you have any questions about hip bursitis, hip pain in general, or anything about injuries related to trauma, please feel free. Email me, jim@ramoslaw.com, and I'll help you in any way that I can. If you found this helpful, please send it out to your family, friends, coworkers, teammates, whoever that you got, that they can benefit from that as well. Because it's something that we really want to do, is give out free information to people to help them live a healthier, better life. Because for us at Ramos Law, we really believe your health matters.